Welcome to our program today entitled Ransomware, Viruses, and Hackers in Healthcare, 5 Steps to Avoid Being the Next Victim. Today's program will last approximately 45 minutes, followed by a short question and answer session. We encourage you to submit written questions during the program. Please type your question into the Q&A widget open on the left-hand side of your screen. We will respond to written questions at the end of the program, time permitting. The webcast console you are looking at can be completely customized. You can resize or move any of the windows that you have open, including maximizing the PowerPoint presentation on your screen. If you experience technical difficulties during the presentation, please visit the webcast help guide by clicking on the Help button below the presentation window, which is designated with a question mark icon. The PowerPoint presentation will be available on our website at Foley.com in the next few days, or you can get a copy of the slides in the resource list widget on your dashboard. As a reminder, today's program is being recorded and will also be available on Foley's website in the next few days. Foley will apply for CLE credit after this web conference. If you did not supply your CLE information upon registration but would still like to receive CLE, please send an email to me, Sivan Galinsky, at sgalinsky@foley.com. To be eligible for CLE, you will need to be logged into the program for the entirety and answer a polling question during the program, which will appear on your screen later in the program. As a final note, those seeking Kansas, New York, and New Jersey CLE credit are required to complete the attorney affirmation form in addition to the polling question that will appear during the program. A 5-digit code will be announced during the presentation. Please email the completed form to me again, Sivan Galinsky, sgalinsky@foley.com immediately following the program. And now I'll hand over the program to our speakers, Mike Overly and Shanley Howell. Take it away.
Thank you, Sivan, and thank you everybody for attending. My name is Shanley Howell. I'm a partner with Foley and Lardner in our Jacksonville office and practice in our technology area in privacy and security. And thank you for attending this important and interesting topic. It's been in the news lately, very much front and center, lots of headlines about this topic. So it's a very timely issue to be talking about and thinking about within your organizations. Candidly, as you may or may not know, it's not a new issue, but with the recent attacks that have been occurring, not just in healthcare but in other industries, it's becoming a very significant threat and one that can cause significant damage to organizations. So it is very important. I applaud you for attending this topic and for taking this seriously within your organization. The agenda for today, I'll just go through real quickly. First, we will talk about an overview of what the current issue is and what makes this particularly problematic. We'll go through some statistics that talk about the increasing risks relating to information security. We have some statistics about the number of attacks on the rise, the various sources of attacks, and the cost for attacks. And our clients, when we work with our clients, this type of information I think is useful because as you'll see, one of the important aspects to keep in mind is that the entire organization, and including senior management, needs to be heavily invested and heavily involved in dealing with these risks. And when there are folks in the security area and compliance area that care about this, it can be very useful to take these statistics to senior management so that they can understand the impact of this and the potential problems if it's not dealt with seriously. We'll also talk about why cyber attacks in particular compared to other security risks, because I imagine a number of you on this call deal with all sorts of information security risks and mitigation. But we'll talk a little bit about why cyber attacks in particular and malware are particularly insidious and difficult to deal with when compared to other risks. We'll also talk about why this is happening more now and why the risk is increasing now. And then finally, we will hopefully give you some very practical advice 5 steps that you can take now to help mitigate these risks. So I will turn it over to my colleague Mike Overly to talk about the current threat.
Hi, this is Mike Overly, and I'm a partner at Foley and Lardner's Los Angeles office, and I practice in the information technology and outsourcing area, and also a member of the firm's privacy and information security group. So let's talk a little bit about the current threat. First of all, a word about ransomware versus other types of viruses or malware. So ordinarily when we speak of viruses, what we're talking about is a situation where normally a third party is trying to disrupt operation of a company's systems, but more likely to potentially get access to information on the company's systems in order to exploit that information, possibly sell it, possibly use it themselves, etc. But the goal is to likely get access to information that the business holds in confidence. Ransomware, on the other hand, has no interest in getting access to the data. Rather, the point of ransomware is to deny the target company its access to its very own data. So if you will, it's a little bit like a denial of service attack that you may have heard about, but kind of done in this way where they're trying to simply deny a business, a healthcare provider, for example, the ability to get access to its patient records or other information for operations. One thing to point out is that when people think about information security, and this is sort of a concept that's been in information security for 20, 30 years, when people think about information security, they normally think about breaches of confidentiality. But confidentiality is only one element of information security. There's an old acronym called CIA, and it stands for confidentiality and integrity and availability of information. And the three of those components together, those form true information security, not simply the very first element, which is confidentiality. So very quickly, information needs to be confidential, certainly. It needs to have its integrity preserved, meaning that the business can rely on that information as being accurate. And finally, the information needs to be available for use when it's needed. Easy example, if you have an ER physician and someone comes in with an emergent condition and they need to get access to that person's medical record, of course they want to make sure that medical record is confidential. But they also need to be able to rely on the information in the medical record, that the allergy history, drug history, for example, is accurate and can be relied upon and has not been, for example, changed by a hacker. And finally, if the patient is there with a condition that requires immediate care, the record needs to be available when needed. And so ransomware really goes to the last of these elements, which is the information is no longer available for use when you need it. By most reports, there are potentially hundreds of new viruses propagating on the Internet every single day. That's hundreds of new potential threats every single day. And we'll talk in a moment about why that is so. Now, you've all heard about antivirus software, so shouldn't that be there to protect us against these threats? And the answer is possibly. When you read the ads for antivirus software, you'll frequently see claims that the software is 99, 100, maybe not even 100%, but 99.9% effective in preventing viruses from entering a particular system. The problem is that most antivirus software works essentially by comparing potentially harmful code against a database of known, if you will, virus signatures. And so if they get a comparison that there's a match, they know it's a virus, and they have specific things they can do to prevent the virus from infecting the system. The problem is there's a gap between when a new virus comes on the scene and when the software can be updated to address that virus, which is why you see your antivirus software being updated periodically. That's to update the database of virus signatures that it has. So one company in Israel did a study. They said, well, let's look at brand new viruses and let's see how effective the leading antivirus software is against brand new viruses. That is, viruses that are not in the database that the virus software operates from. Remarkably, when they did that test, they found that only 5% of viruses were detected. Let's do it the other way. 95% of viruses went unnoticed when we're talking about brand new viruses. So does this mean we have a massive problem, particularly for ransomware? The answer is actually no. The most popular form of ransomware right now, CryptoWall, and we'll talk more about that in a moment, is actually a reasonably well-known virus, and one for which any relatively new and updated antivirus application should have relative ease in identifying and preventing. So why do we have this problem today? The answer is really several elements. The first is that some people are using outdated or improperly configured antivirus software. The next problem is that many businesses, in fact I would go so far as to say almost every business, is using at least some form of commercial software that isn't properly updated, that isn't properly maintained. Likely in your own computers you see that Windows is always installing new updates, as is copies of Microsoft Office, and in many instances those updates are to address new security problems. Remarkably, even sophisticated organizations have complex pieces of software on their systems that are in fact not fully updated. The other problem is open source software, and recent studies show this to be the case. If you're not familiar with open source software, it is simply a form of software which is available free on the internet. The source code of the software is available, and normally people work on these as hobbies potentially, on non-work hours, but of course there are many commercial applications for open source as well. The problem is that some open source software simply isn't well maintained. It may not have been updated in years, and this can pose security threats. Let me give you one example from a study that came out just this past week. 90% of Android devices, that's phones, that's tablet computers, many of which are being used in healthcare context, are in fact using outdated versions of the operating system, susceptible to exploitation. Another reason why we're in the problem area that we are is that there are lots of end-of-life or end-of-life hardware or software. Many organizations have very old pieces of legacy software that are no longer supported by their original vendors. They have pieces of hardware that are no longer on maintenance plans, and so these things are not updated to potentially address new security threats. Another potential cause of why we are in the position we're in today is that organizations aren't adequately conducting backups and also drilling for disaster recovery and planning for business continuity in the event of an event just like a ransomware attack. In many instances, if a backup had been made, the ransomware would be far less effective. Now, there are, of course, situations where ransomware may essentially remain dormant for a long period of time, and so the ransomware itself may be copied to your backup media. But it's important to think about these things and have appropriate backups, and certainly to have appropriate business continuity and disaster recovery plans in the event of an attack. Lastly, and possibly one of the most important things to think about, is the insider threat when we're talking about viruses and other security issues. And what I'm referring to is a business's own personnel, their physicians, their staff personnel, etc., as well as their vendors, their business partners, those with whom they connect their systems, those who provide services to the healthcare entity. They can present risk to the organization. A quick example of that is, suppose I want to target a particular healthcare provider to propagate a virus to them. And suppose I decide I want to be sure that it's absolutely transmitted onto the healthcare provider systems. And so I might send email, but possibly another way to do it is to simply take, say, a USB drive, have a label put on it that says radiology, for example, maybe even say confidential, and put a virus on that, walk it into the cafeteria in that healthcare provider, and simply leave it on a table and walk out. Likely by the end of the day, someone at that healthcare provider will pick up that USB drive, plug it into a system at that healthcare provider, and propagate the virus. So insiders need to be trained, and we'll be talking about that in more detail later, and that training is absolutely critical. So let me just quickly finish up by talking about ransomware a little more particularly, and specifically the crypto wall virus, which is certainly the most successful of the ransomware applications. To date, about $325 million in damages. Studies show that 44% of organizations, in fact, end up paying the ransom, and likely that number is a bit higher. In many instances, payment of the ransom is not publicized. If we talk about the events with the healthcare provider that just occurred in Hollywood, reports indicated there was an original demand of about $3.6 million. There is, however, some question as to whether that was the right number. It's substantially higher than most attacks. The actual payment was about $17,000, but studies show that the normal run-of-the-mill ransomware attack really involves the payment of only about $400 or $500. So you can see why some organizations would simply write the check. 39% of people that responded to a recent survey say they expect to be attacked again in the future after a ransomware attack. So payment is made by untraceable Bitcoin, meaning that it is not possible to track down where the funds actually go. In some instances, paying by Bitcoin may itself put your payment information at risk. That is, the information that you supply to buy the Bitcoins. The decision to pay is difficult. It's essentially negotiating with terrorists, and there's very good reason why the United States, for example, doesn't negotiate with terrorists. It sets a precedent for future attacks. So paying once does not mean that you won't be attacked in the future. In fact, it may gain you a position on a list maintained in the hacker community as a known mark for future attacks. The last thing I'll mention is that paying does not mean that all elements of a virus or ransomware attack has been removed from your systems. In fact, residual elements may remain and may cause harm in the future. And so there are very many risks to potentially writing a check. Even though the dollar amount may be low, the end implications may be continuing for your organization. And with that, I'll turn it back to Chanley.
Thank you, Mike. Let's talk now about what makes healthcare industry particularly vulnerable. 7 years ago, almost to the day, on February 17, 2009, President Obama signed into law the American Recovery and Reinvestment Act, which also had the HITECH Act within it, which you are probably all aware of. And it brought in the concept of meaningful use for using EHRs. So for the past 7 years, there has been, as you all know, a very concerted effort and incentivized program for adopting EHRs. And EHRs are becoming ubiquitous in all organizations. That's a benefit, but it also, when information is moving to electronic as opposed to paper-based, that causes a vulnerability and increases a risk that did not exist 8, 10, 20 years ago. So while EHRs certainly have a benefit, it's also resulted in increased risk. And as Mike touched on, it's not, when we're talking about ransomware and similar malware, it's not necessarily about stealing PHI. Until recently, when we talked about security and breaches in the healthcare industry, it was always about the unauthorized use or disclosure of protected health information. And with that comes the obligation to notify and potential claims, which, not to minimize, is an entirely different animal than ransomware that can disrupt the organization and essentially completely bring it to its knees. As you've seen in the reports in the news lately, we saw that for several days an organization could not conduct business online. And in today's world, that is very scary. And with identity theft, it typically doesn't threaten patient care and safety. That's what everybody on this call is all about. That's what your organizations are about, is protecting patient care and safety. And when you have a risk like this that jeopardizes that, it is a problem, and it's scary, and it needs to be dealt with. And if you do any reading on this topic at all, experts are unanimous in saying that this threat is not going away anytime soon, and it's only going to increase. Also, keep in mind the threat is not just to EHRs, to electronic health records. It's devices, and we'll talk a little bit later about the Internet of Things, but almost any device, any object today, whether it's in a healthcare setting or not, can have a sensor on it. And if it has a sensor on it, it can connect to the Internet. As we all know through Wi-Fi and cellular, connectivity to the Internet is ubiquitous. So any device can have sensors of all types. So the threat is also to monitors, pumps, and other devices within a hospital or a physician office. And if that's shut down, there may not be a lot of protected health information in a device. But if the device is shut down, again, that is a big problem that needs to be dealt with. Also, in addition to just EHRs, there is a push for connectivity. Health information exchanges are becoming very, very common. Community physicians are obtaining access to hospital systems through their EHR systems and enterprise-wide systems. And so again, while the benefit of connectivity is very good, when it creates an additional risk, it's something that needs to be dealt with. And what we see in the security breaches, not just among our clients, but when we look at statistics across the industry, in the healthcare industry, when there is a breach, the common deficiency and the most typical deficiency by far is the lack of an effective risk assessment. And as you know, under HIPAA, organizations are required to conduct a risk assessment. And what we see is that companies either do not do the risk assessment, or if they do it, it's at a very high level, going through the motions without any real substance. So I would encourage you that when you are going through your risk assessment process, make it meaningful. Don't just check the box, but get into the substance and truly assess what risks that you have and what you're doing to mitigate those risks. Additionally, it's not just your systems. It's the systems of your vendors. And again, in this world of connectivity, it's not just physicians that are connecting to hospitals and back and forth. It's all sorts of vendors will have connectivity into a system. In the non-healthcare industry, you may recall that's what caused the Target breach back in December of 2013. It was not Target's system per se. The malware came in through a vendor. So it's important to conduct due diligence, have contractual protections, and have continuing monitoring and supervision of your vendors to be sure their information security is up to par. And finally, and most importantly, and you will hear us say this a lot today, but it bears repeating several times. It's not just the technology; it's the people. The most common way of delivering the type of malware and ransomware that we're talking about today is through attachments to emails where a user clicks on the attachment, or through an email that has a link to an infected website, whether it's the website itself or clicking on advertisements. So while, as Mike spoke about, antivirusware is a very important piece to this puzzle, he also noted that there are new versions of this malware coming out all the time, and the bad guys have there's a lot of money at stake, and they're spending a lot of time coming up with new ways to get into systems. It's the proverbial cops and robbers. The robbers get more sophisticated, and the cops have to keep up. So a big part of this is training your people to be constantly on guard. And when we get 100, 200, 300 emails a day, it's very easy when you're going through your emails to click on things that you shouldn't. But it's also very, very important that employees take time, slow down, and watch what you're clicking on. And the attacks are becoming much more sophisticated. So while 5 or 10 years ago, you might get an email from somebody saying they were from Somalia. Today, you might get an email from your CEO or your CFO, but it's not really from your CEO or your CFO because the phishing attacks and the spear phishing have become so sophisticated, and there is so much information online to know who the people are within an organization to be sending your people emails and then to be able to spoof those emails. It makes it very difficult for employees to understand and to identify what's a good email versus a bad email. But training is very, very important. So now some of the statistics I was talking about, and this one shows from 2012 to 2013 or 14 the tremendous increase. And as you can see, it's 81% increase from 2013 in the number of data breaches. And this is industry-wide, not limited to healthcare. And as we'll see in a minute, healthcare typically is, unfortunately, on the higher end of attacks and breaches. But it's increasing, and we certainly have no indication that we've reached a plateau. Maybe someday we will, but we're not there yet. This slide is from the 2015 Verizon Data Breach Report. And if you're involved in security for your organization, then I would highly encourage you to consult the Verizon reports. There's a number of reports that come out, and Verizon is a very, very good one. But this shows the different sources of breaches. And Mike gave the example of a USB being left out for somebody to pick up. That would fall under the category of miscellaneous errors, which is number one on the left side of this chart. The left side is all security incidents, and then the right side is security incidents that resulted in a confirmed breach. Sometimes we know there's a breach of Verizon, and publicly we know sometimes we don't. But as you can see, miscellaneous errors, which is basically employee mistakes, that'd be picking up the USB and putting it in a drive, or posting sensitive information online to an unsecure site when they shouldn't and didn't mean to. That's a very prominent cause of security incidents. And then if you look at the second most prevalent on both charts, crimeware, that's the area we're talking about with the ransomware and similar malware. So the second most common incident and the second most common incident when there's been a confirmed breach is crimeware. This slide has to do with the increasing costs of breaches. And I apologize for having to show this to you, but if you look at number one, and this is depicted by the bar charts, number one, quite frankly, by a long shot, is in healthcare. And as you probably know and have heard, one of the reasons is that the value of health information and insurance information is much, much more valuable these days than credit card information. When there's a side-by-side comparison, it's the value of protected health information essentially dwarfs the credit card information. So as you see, retail on the chart that's on the left is way down. In fact, it's even below the average of $217 per record. So it's healthcare as a target. And then if you see the chart on the right, the average cost of a breach is $6.53 million. So again, if senior management is not on board with what your security folks think is appropriate and needed for your organization, these figures should go a long way in convincing them. And with that, I will turn it back over to Mike to talk about why cyber attacks are so insidious.
Thanks, Janley. So first of all, let me say that I think one of the biggest misconceptions about hacking, cyber attacks, the propagation of viruses, and certainly in the case of ransomware, when you ask number of people. What do you view as kind of the stereotypical hacker? Most people will answer, well, it's a teenager located in some country like the Philippines, for example, or China, and it's sort of this solo person sitting in an internet coffee shop drinking caffeinated drinks all day and propagating these viruses. And certainly that is one possibility. But today, hacking is big crime. We're talking about hundreds of millions of dollars. We're talking about organized crime being involved. We're talking about hacktivists, those that have an agenda who are propagating these attacks. And we're talking again about insiders, potentially disgruntled employees or former employees propagating these attacks. So there are a wide range of people involved, but we're no longer speaking in terms of the sort of solo people potentially working alone, but rather we need to start thinking about organized crime, folks that have come together that this is their business. If you think about it, it's quite enticing. Instead of walking into a bank and trying to commit a robbery, which has lots and lots of risk associated with it and a very high probability of arrest, and certainly a high probability of potential physical harm, either to individuals in the bank or potentially the robbers themselves, we're talking about a form of crime that has a very, very, very low possibility of being arrested. We're talking about, and we'll go through this in just a moment, freely available resources that can be obtained online to help propagate these attacks. We're talking about no investment whatsoever in order to propagate these attacks. And we're talking about forms of compensation like Bitcoin, which are entirely untraceable, in fact, are designed to be untraceable. It is a very, very enticing opportunity for criminals. So looking at the slide that's before you now, first of all, at the top at 12 o'clock, frequently leaves no traces. It is frequently very difficult to determine whether an attack has occurred. In fact, some studies show that on average, a very significant amount of time, sometimes more than a couple of hundred days, go by before organizations even realize that they've been attacked. That's a couple of hundred days where someone's had free access to their systems and the data they contain before they even take remedial action, before they even know about the attack. Moving around the clock clockwise, easy for an attacker to hide. There's something called the Tor network, which if you're not familiar with it, if you type in Tor or the original acronym, the Onion browser, you can download software to your computer. The software is available. Essentially, it was originally created as part of a government program under DARPA to find a secure way of browsing the Internet. It routes Internet traffic all around the world through random sites, making it impossible to trace back where the original person is. And so it's very hard to track these folks down. Moving further, no need for physical contact with the victim, and this is my example of the bank robbery. There's no physical risk whatsoever to the criminal or the hacker now. They can do this from afar. Very small investment can cause massive potential economic damage. There are actually books written for non-technical people, and this will be the next point that we talk about, which essentially can take anyone with no real technical knowledge and educate them as to how to cause harm to even a very large, very sophisticated organization using freely available tools. And that's the next point. There are essentially marketplaces online that one can go to find the tools to create viruses, to learn about social engineering, to understand how to attack a particular company. These things are freely available. To return to Chanley's discussion of just how easy it is to commit phishing these days with the information involved, consider essentially the following scenarios. Suppose I want to target a particular healthcare provider. I simply go on their website and find out who, say, all their cardiologists are. Then I do a Google search and I find out who one or two of the most recognized, well-recognized leading researchers in cardiology are, and those that are publishing multiple papers. I then create a virus, put it in a PDF, and give the PDF the name draft article on, and specify some, cardiology-related topic. And then I send it to each member of a healthcare provider's cardiology department and say, spoof it from this particular researcher, and it's very easy to spoof email. Someone can learn to do it in literally a couple of minutes, and it's very, very hard to detect that an email has been spoofed. Make it look like it's coming from the researcher, and say, hey, I'd really like your help in reviewing an article that I'm considering publishing in the upcoming whatever journal, and I'd be willing to bet that it will be almost irresistible for some members of that department to not click on that PDF and infect the organization. There are many networks and countries that may be involved, and again, by definition, these hackers use the Tor network, which is essentially a means of routing information all over the world through many, many countries in order to disguise and make it difficult to track back exactly where the original messages came from. And to give you an idea of just how difficult this is, it is considered virtually impossible. In fact, the Russian government has offered a very substantial bounty to any hacker that can show the Russian government how to, in fact, decipher the Tor network and figure out who is sending messages. Inadequate non-uniform regulation and laws. Frequently, if you do find a hacker, that hacker may reside in a country or be located in a country where they don't have hacking laws, that it may not, in fact, be illegal to prosecute them. So even if it is possible to identify who is responsible, bringing that person to justice, highly unlikely in many instances. Moving on to the next slide, which ties in with this one. Where are we now as far as, why are these things happening? And Chanley has mentioned several of these things, which would be the Internet of Things, the interconnectivity of various networks. Healthcare providers are now reaching out more and more for the good, mind you, and exchanging information with other healthcare providers, participating in health information exchanges, which has led to the creation of extremely large databases of information. Those databases are, very interesting targets for hackers. If you think about it, it's one thing to go and hit 100 different organizations for their data, or I can hit one organization that has all of the data, one of the exchanges, and get it in one place. There's system complexity, and what I'm talking about here really is just how complex health information systems have become. There's a measure of programming called lines of code, or LOCs, and it simply refers to how many lines of programming comprise a particular computer program. And for a complex medical information system, it could be hundreds of thousands of lines of code. The Carnegie Mellon Institute, which is well known in information security issues, did a study, and what they found is that the average commercial piece of software, such as a medical information system, contains between 20 and 30 bugs in every 1,000 lines of code. So if you have several 100,000 lines of code comprising a medical information system, you're talking about potentially thousands of bugs that can be exploited by a hacker to gain access to the information in that medical information system. Everyone remembers the debacle when the healthcare.gov website was rolled out. By some estimates, it had several million lines of code in it. One can easily see why there were so many problems with that website. And so lines of code equates to system complexity, which equates to potential risk as far as exploitation by hackers. And this ties in with what we're going to be talking about as far as our 5 steps in a moment to mitigate risk, in thinking about what kinds of things you need to be talking with your vendors, licensors, and suppliers about when it comes to information security. The last thing I will mention is this sort of interconnectivity, particularly with vendors and business partners. As healthcare organizations more and more are looking to the cloud-hosted services to host their information systems and their data, there are growing risks associated with that. And again, we'll talk about that as part of the mitigation efforts in just a moment. And now back to you, Chanley. Or actually to Sivan for the CLE code.
Thanks, Mike. At this time, we're going to take a short break. I'm going to read the CLE code for this program. Just as a reminder, if you need CLE for today's program, please enter the 5-digit code I'm about to read into the poll question slide on your screen after it's announced, and please make sure to press the submit button so we can record your answer. The code is, I will read it twice, and please keep in mind it's a combination of numbers and letters, so please listen carefully. The 5-digit CLE code for this program is the number 3, the letter C as in cat, the number 9, the letter P as in peanut, and the letter O as in orange. I'll read it again. The number 3, the letter C as in cat, the number 9, the letter P as in peanut, and the letter O as in orange. Again, if you're seeking CLE credit for this session, please complete the polling question by entering the code that was just announced and pressing submit. The polling question will remain open for about 2 minutes. For those seeking Kansas, New York, and New Jersey CLE credit, please make sure that in addition to the polling question that you answer, you also submit the attorney affirmation form, which can be found on your widget, the resource widget on your page, and return it to me immediately following the program. And we'll just wait about a minute or two to give everyone a chance to answer the question. Okay, at this time the poll is now closed, and I'll return the program to Chanley.
Thank you, Sivan.
Sure.
All right, let's talk about steps that we think organizations should take to mitigate these risks that we've been talking about. Step number 1, and all of these steps we feel are very important. This is probably, it's not by coincidence, this is number 1. That is, move information security to the right level. 10 years ago, senior management and boards of directors had very little input and very little visibility into the information security of an organization. That has completely changed within at least the last 3 years. I personally dated back to the Target breach because the Target board was sued, and there's been boards sued since then. It's in the news frequently when senior management and executives are fired or they resign under pressure to do so because of a security breach. So the senior management should be involved not just because of their jobs, but it is their obligation. For the board and senior management, they have a fiduciary duty to the organization to protect its assets. If its assets are being either stolen through PHI being compromised, or if their assets are being damaged by a company being shut down due to ransomware, then that is damaging the organization and the boards, whether it's a public company or a private company or a nonprofit organization, all owe a duty to protect those assets. So it's a senior management and board level responsibility. And the senior management needs to understand the issue. Certainly delegation is the way things work. And the IT department and the security professionals and the security engineers, whether they're internal or external, are the ones who implement the safeguards. But it's incumbent on senior management to make sure that that's pushed down. And not only the security consultants, but the people. You've heard us, Mike and I both talk today. It's a big people problem. And training in this area should not be just going through the motions. It needs to be substantive. It needs to be directed by senior management. It needs to be part of the organization's mission and core for compliance. And senior management needs to hold its employees in the area and consultants accountable. And the only way to do that is to get input from the employees and consultants on what is happening, and if things go wrong, to hold folks accountable. And as I discussed, the senior management faces direct liability, so it's certainly in their interest to do so. Step number 2, if you want to protect your data, you certainly have to know where it is. Risk cannot be controlled if you don't know where the data is. You have to know where it is to be able to protect it. And as Mike pointed out, particularly in the ransomware area, the importance of an effective backup and disaster recovery system and program is critical. So there must be written policies that deal with this, and when the policies are written properly and have the right information, that's step 1. Then step 2 is implementing and training on the policies, and step 3 is making sure that the people charged with implementing the policies are actually doing that, and that's through an internal or external audit process to make sure that the policies that have been written are being properly implemented and followed. And step 3 is following on what I just said about the policies, reviewing all of the different information security policies for the organization. As we've talked about, individual users are key to this process, whether it's individuals in the IT department and security department. They need to be able to know what they're supposed to do and be trained on it. And across the user organization, anybody who has access to any electronic records or to email, organization email that could be used to compromise the system, need to be trained to help mitigate these risks. And I will turn it over to Mike for the next steps.
And one point to follow up on, as part of the materials that you will be able to get as part of the presentation is sort of a personal, if you will, security checklist. And what we have found, and researchers in the information security area have also found, is that if you want to get individuals interested in better security, make it personal to them. And I'm not talking about taking action against them, but more importantly, let them understand how important information security is as an individual. And this means tying it to their own information, meaning that if you can help individuals learn how to better protect their own personal information at home using antivirus software, being more careful about phishing attacks, those sorts of things, they're going to be more likely to be responsive and to be proactive about that at work. And so one of the things we put together, which is part of the materials, is a checklist to help individual personnel understand better how to protect themselves at home and how to make themselves better personnel at work to protect the organization's information. So please take a look at that. We've had very good interest from the companies and healthcare providers that we work with as finding that to be a very useful tool for their personnel. So moving on to just the last steps 4 and 5, and please feel free to type any questions to us using the widget that's on your screen. We'd be happy to respond to them in just a minute. So step 4, and this ties in with one of the very first things we talked about, is updating your systems to make sure that all system software, all hardware are properly updated, to make sure that at least they have all the relevant security patches in them. As I mentioned, it's very important to look for and now be proactive in removing open source software which has been, if you will, orphaned, which hasn't been updated in a very long period of time and which may present security risks. You'll also want to potentially think about now developing warranties, and we can provide examples of such warranties that you would want to require of your own vendors who are providing information systems, providing hardware products, that they themselves don't include this sort of outdated software, end-of-life type of product in something that they may provide you because of the security risks. And that sort of leads us to step 5, which is being vigilant in your vendor and partnering relationships. And unfortunately, there are three alarming trends here that I want to emphasize with regard to vendor relationships in particular. And those are the following. First of all, over the last 18 to 24 months, we are seeing a substantial change in the way vendors, particularly cloud vendors in the healthcare space, are trying to really restrict liability and responsibility for their actions, including information security compromises. And so thinking about what kind of liability a vendor is willing to assume, and it means nothing if the vendor has the world's best information security plan and procedures and policies if they have no real liability if they actually violate information security. The other trend that we're seeing is that contracts themselves are becoming far more undefined. It is not unusual now to open up a healthcare information system contract and find that, say, support obligations, service levels, the product description itself, all are provided through URLs or websites, which can change at any time. If those things can change, some of the most important elements, including information security, may not be what you think they are supposed to be. And so it's important to lock those things down. And finally, a point that Chanley made that I want to circle back on, which is, where is my data? Where is it located? If we're talking about cloud engagement, sometimes that's incredibly hard to find out. In many instances, cloud providers reserve for themselves the right to transfer your data anywhere in the world they desire, frequently without notice to you and certainly without your approval. Remarkably, in some instances, cloud providers will put the burden of compliance in their decision to move your data around the world on you. That is, they require you to figure out where all in the world they might move your data, and then you're responsible for obtaining all the consents and complying with all local laws related to their movement of your data, which is essentially impossible. These things are negotiable, but they should be looked for in cloud engagements. So just to quickly summarize, step 4, make sure that you're using the latest. And now, there are security risks actually in updating to the latest, and you need to make sure that it's done in a proper manner, which ties back to Chanley's point on policies, an appropriate approach to change management of systems, and making sure that there's testing before patches are implemented, but that patches are implemented in a timely fashion. And then finally, in step 5, looking at and evaluating vendor relationships and potentially making hard decisions when negotiating those contracts to make sure that it's not just that you have great information security protections, but that there's actually vendor responsibility in the contract to, really have some skin in the game if, for example, there is a breach. And having a BAA is certainly very useful, but normally spelling out those security obligations and being far more particular is absolutely critical. In many instances, vendors simply don't appreciate the requirements that HIPAA imposes with regard to information security, and it's better to spell out your expectations. And with that, I'll turn it back to Chanley for a wrap-up.
Thank you, Mike. I hope that has been useful for everybody. Please feel free to submit questions if you have them using the widget on the site, or our information is available if you would like to contact us directly. I also wanted to follow up with Mike. Mike pointed out we have the information security checklist on our resource list on the web page that you use to access this webinar. We also have on that resource list our cybersecurity white paper. So a lot of the concepts and the tools and the advice that we have been talking about today are in that white paper, so we encourage you to download that and use it, and we hope that it will be beneficial to you for that. I'm looking to see if there is a question. There was a comment, but not a question, so we appreciate the comment that was just made. And if there's no questions, Sivan, does that wrap things up for us?
Yep, and I'll just advance the slide so you can see Mike and Chanley's contact info. Feel free to reach out to them if you have any follow-up questions or would like to learn more about the topic or would like their assistance on anything. And again, just as a reminder, please make sure to send me your CLE affirmation forms if you're looking for Kansas, New Jersey, or New York credit. We will work on getting CLE processed. It usually takes about 8 weeks. there's anything else anyone needs, please feel free to contact Mike or Stanley or myself, Yvonne Galinsky. And thank you so much for attending our program today.
Thank you.
Thank you.